Yo, what up, YouTube? This is Dr. Jared Williams, and I wanted to go over with you all the painless injection technique. On my other social media platforms, I show doctors, specifically dentists, how to smile after surgery. And I found that people really want to know how to give painless injections. So before I get started into showing you the exact technique, I just wanted to give you some clarity on why the painless injection technique is important. Well, number one, if you're a dentist and you're giving any type of care, you're gonna have to use a dental syringe. All right, that's gonna be something that's gonna be common. You're gonna have to learn how to use one of these. And I'm gonna use the term claw. I'm not gonna use the term dental syringe. I'm gonna use the term claw, and it's synonymous with this device here. The reason why it is important is simply this. Every patient that comes into your office is scared out of their mind, even if they're just going to get a cleaning, let alone having to deal with the claw. And it is so important as a dental professional, specifically the dentist, or if you're a hygienist and you're able to give injections, or if you're a dental assistant, I'm not quite sure exactly the rules, and I don't know when you're going to be actually watching this video and the state that you're in or the part of the world that you're in. But it's all about decreasing the amount of anxiety that patients deal with as you are treating them for their dental treatment. So the painless injection technique is really to benefit you as a clinician by decreasing the amount of pain and anxiety that a patient feels. They're going to be relaxed. You're going to be relaxed. Your assistant's going to be relaxed. And generally, you're going to get really good treatment that is going to transpire during that visit for the patient. So that's the importance of having a painless injection. The benefit of having a painless injection is this. Word travels. Yes, you got it. Word of mouth travels. So if you're the doctor in the area that's providing dental treatment and you didn't cause pain to patients, they're going to flock towards you and want to give you as much service as possible. So let me just take an aside and kind of give you an idea of what I do. The background of what I do presently is to provide oral surgeon implantology for numerous offices within my area of Houston. And I do a lot of nasty surgeries, which you all would consider nasty. I kind of consider it art. And I am taking out wisdom teeth, placing implants, dealing with a lot of infection, taking out tori, doing biopsies and different things. And most of the times when I'm giving anesthetic to my patients, they don't even feel it. And so the reason why it has garnered attention is because individuals want to come to a clinician that's going to provide them with the best care possible. And if it's the best care and it doesn't hurt, they're going to be there for you. They're going to run towards you. So word of mouth is a first benefit. The second benefit is this. The patient is going to be comfortable. Like, I don't know if you've ever been in a situation to where you are paying for something, and generally dentistry here in the States is pretty expensive, but if you're paying for something, it's one thing to pay for it, but to be uncomfortable in paying for it, you tend to have second thoughts. And so another thing to keep in mind when you are being the clinician that's going to be providing anesthetic and having a painless injection. That's the second benefit. The third benefit is this. You're not going to do any harm. Let me get real close to you. You're not going to do any harm. So as you are giving this claw or you're administering the anesthetic, you're not going to be doing any harm to individuals, because if a patient sees this, they're going to say, oh my goodness, they're going to be giving me a needle that is larger than my head. In actuality, it's not the needle that's the big thing. It's just the noise that it makes. As you can hear mine, it's kind of shaky. It makes a little noise. So if you hear that, it's like, oh my goodness. And then it's right by their ear so they could hear it. And then they're in the dental chair looking up in a bright light, ready to run out of there. And it's not something that you are, it's not like you're giving them strawberries and chocolate and they're watching a movie. Like, they're literally hearing the drilling of your handpiece, and now they got to hear the shaking of the claw. But in actuality, the needle is only maybe about the size of my triple digits. My hands aren't too big. About the size of my nose. That makes any sense? Kind of give you perspective. So you don't want to let the patient feel like they're going to be harmed. So that's the third benefit of it. So just to give you that idea, the next aspect of it is this. By providing those three benefits, the next aspect of the JW method or the painless injection technique is there's some neuroscience pathways that actually transpire in your brain as you are feeling any type of noxious stimuli, which is pain, or if I were to pull this needle out and I were to stick myself there. So you see that? I'll be sticking myself. I don't feel it because I'm meditating. Just kidding. But the reason, so the pathways of the of your neuroscience, it travels on a different pathway than if I were to do any vibrations here. So if I were to shake like this, I'm gonna feel a lot. The pathways that are that it takes to respond to a vibration, a somatosensory, versus a noxious or painful stimuli like a pinch or a needle, they travel different, they take different routes. And the one that's the fastest is the vibration. So if you are on the same side of where the pain's coming and you vibrate that area, the likelihood of the brain recognizing it and letting your body know, ouch, to even say that, it's going to go so much faster. So if you vibrate and stick or vibrate and pinch, you're not going to necessarily feel it. So I challenge you today. I want you to go to your friend, pull them aside and say, hey, I want to try a little trick on you. What you have to do is pull their skin or just vibrate their skin in the area, and with your other hand, pinch the same area really close. So if you're gonna pinch them here, vibrate right here. And what that'll do is it'll scramble their brain. They won't be like, but they'll be like, they won't be able to determine the difference between your pain. And literally what I've done with some of my dental assistants is some of my colleagues, I'll literally pinch really, really hard. I'll vibrate first. Sorry. I'll vibrate first and I'll pinch really hard. And I'll say, do you feel anything? And I'm pinching hard. Do you feel anything? And I'm pinching harder. Do you feel anything? And pinching harder. They don't even feel it. But then if I take away the vibration and I pinch them, they'll be like, ow, that hurts. So to let you know it works. So that is the benefit behind the painless injection technique. So as you give patients anesthetic, what I like to do is this. I like to, one, don't show the patient the claw, all right? Don't let it make any noise. I'm pretty sure there's a lot of manufacturers out there that make these claws in a form that they don't make noise. So just want to give you that heads up there. But if yours does make noise, similar to mine, literally, and if it doesn't make noise, literally pass the claw away from the patient's eye so they don't see it. Or if you're passing it, pass it above their head so they don't see it. It's really important that you get that, because if you just get callous with the cavalier, I would say, with just passing the needle, if you see this passing through your eyes and you know that you're about to get that needle, you don't want that. So why do that? Why give that to the patient? So it's just something to take in consideration as you are providing care to patients. If they see it, they're probably going to feel it. But if they don't see it and you trick them, you're winning. And you're going to get all those benefits I highlighted earlier. So what I like to do is this. Generally, I give a lot of Gal Gateses or inferior alveolars. And what I'll do is this. I'll literally, and let me take a step back. In certain books, it highlights the type of syringe that hurts worse. This is a 27 traditional long needle, as you can see, and the gauge is a 27 and it's long. And this is all I use. I don't use a small. I don't use an. I don't like any. I don't like any of that. I like to keep it simple. I like to use a 27 long for everything. I don't, whatever it is. There's a saying that says, what you can do with the long, you can't do with the short. But what you can do with the short, you can't do with the long. What you can't do with the long, you can do with the short. So this is all encompassing. The JW method is all about making surgery simple within the dental realm. So with that being stated, I'm going to show you my technique. I'll literally have the patient open big as I can, and I'll shake them like this. And so, for one, if they don't know what's happening next, they're going to be like, what the heck is going on? And then you're already giving them medication. So I'll literally grab their cheek, open, and I'll shake it. Just like that. So if you could hear that noise, you're shaking well enough. Now if you're dealing with some people who are super sensitive, don't shake them too much. Just kind of get the attention, get their attention by just shaking their cheek, and then give them medication. Most of my patients, when I'm getting ready for thirds, I'll probably give like 10 shots, and they'll be like, getting the medication, I'm shaking, giving medication, giving shaking. They're like, what just happened? I'm like, I don't know. They're like, what do you mean? My lips starting to feel numb. And like, what did you do? Oh, well, I have medication in my gloves, and so when I shake it, it literally goes in through your skin and gets you numb. Now, we know that didn't happen, but I just wanted to give you an idea of some of the little tips and tricks, and you'd be surprised how many people won't feel that happen to them at all. And like I said, I give 10 shots. So if you're doing like a fill-in class 2, inferior alveolar, bam, they won't even feel it. Now I got to go through 10. I even have to hit the palate as well as a greater palatine. So just give you an idea of what you could do. I also found that certain books, and I won't call any names, but certain books, they ask you to administer the anesthetic over a minute. I don't have time for that. And remember, the last benefit was to do no harm. So if I need to give 10 shots, I don't have 10 minutes to give anesthetic. I want to give them the medication. And one of the main things you want to do with this technique is to push, aspirate. And aspirate is literally when you're pushing the medication here, when you're pushing the medication, and you aspirate, just pulling back. And you just want to see if you're in any blood vessels, because you don't want to put epinephrine or lidocaine into a vessel, because it'll give them a flutter in the heart, just make them feel all funny. And I know one patient this week that she was telling me how she went to a doctor to do some treatment. He or she gave them medication, and heart was fluttering so much that she went to the emergency room. Nobody wants to deal with that. Like I said, the main purpose of me giving this information is so that you smile after surgery. And the good thing is that this technique, you could use it for all aspects of dentistry. And for any physicians out there, if you're taking this technique, it's the same exact process. Pinch, shake, give them anesthetic, give them the needle, and they probably won't even be paying attention. So just want to give you some ideas on how to give a painless injection. As a bonus tip, I like to use this. If I'm dealing with the greater palatine or the incisive foramen or the incisive nerve, what I like to do is place the topical like I do for all my injections. And what I'll do is I'll put pressure in the area. So what I'll do is I'll put pressure and then I'll inject. And what I like to do is this. I don't have 4 hands here, but you'll see is, like, let's just say here, the palm of my hand is where that greater palatine is. What I'll literally do is I'll put a lot of pressure with my mirror, and I'll let the patient know, hey, you're going to feel a lot of pressure. If you feel anything sharp, it's just my mirror. If you feel anything sharp, it's just my mirror. And I'll literally press down just so you can see my finger, and you can see I'm not bending it. I'm literally putting a lot of pressure in there. You can see probably my hand turning a little white there, pale. And I'm putting a lot of pressure, and then I go ahead and I get the claw, and I'll stick the area, and I'll place it in, aspirate, give it to him. Give it to the patient to anesthetize the area. And I literally just press on it like you see there. And what that does is, like I said, the pathway the brain recognizes first is the somatosensory, is the shaking or the vibration aspect of it, opposed to the nociceptors that are in the brain. And the somatosensory, the vibration, travels faster to the brain than pain. So just keep that in mind. And by doing that, and what I like to do is this, I like to vibrate the mirror when I'm placing it into the area where I'm giving the injection. So I have the pressure and the shaking and the vibration along with that needle. Now I just want to let you know, I'm right-handed. So I just want to give you an idea. I am right-handed. And it took some time for me to get this technique down. But now I'm literally able to shake and literally have a straight, calm hand as I'm giving anesthetic. So Once again, this is a JW method on how to give painless injections. I look forward to hearing and reading your comments. And most importantly, the whole purpose of this channel is for you to smile after surgery. So when your patients come in and they're ready to get some dental treatment, I want you to do these procedures. And when you do them, I want for you to let me know how it worked out for you, even the bad ones. That's even good as well. Give me your experiences. And I look forward to learning with you. Once again, this is Dr. Jared Williams in Houston, Texas. I look forward to meeting you and even shaking your hand one day. Have a good one.